Most men over 50 are unknowingly inflaming their prostate every single day. Not because of genetics or bad luck, but because of habits they think are harmless. Processed foods, low water intake, even sitting too long. These daily actions silently trigger inflammation and push the prostate toward chronic problems. And here's the surprising part, it often starts before you notice symptoms. Before the pain. Before the slow stream. Before the midnight bathroom trips. By the time the warning signs appear, the damage may already be deep. But with the right knowledge, you can stop this progression and take back control, starting today. In this video, you'll discover the real causes of prostate inflammation doctors wish you knew sooner. No gimmicks, no fluff, just science-backed explanations and practical solutions that could change your daily routine and protect your health for years to come. So if you're serious about staying healthy as you age, hit that subscribe button now and follow the channel for more life-changing insights on men's health. Many men overlook how the food on their plate silently impacts their prostate health. Ultra-processed foods, red meat consumed excessively, high dairy intake, and added sugars are not just dietary concerns, they are hidden inflammatory triggers. These everyday choices quietly fuel a systemic response that can worsen an already vulnerable prostate. The key lies in how these foods elevate inflammatory markers in the body. Substances like interleukin-6, Illinois-6, C-reactive protein, CRP, and tumor necrosis factor alpha, TNF-alpha, rise steadily with this kind of diet. These are not just lab numbers, they signal a body in constant defense mode. And over time, that silent inflammation takes a toll, particularly on the prostate gland. Chronic low-grade inflammation doesn't just stay in the background. It irritates the prostate, disrupts urinary flow, and contributes to conditions like chronic prostatitis or benign prostatic hyperplasia, BPH. A common breakfast, white toast, processed meats, and sugary coffee creamer, might seem harmless, but it's part of a pattern that erodes prostate health day after day. There is a better path. Choosing whole, nutrient-rich foods with anti-inflammatory properties can reduce these inflammatory markers and improve prostate function. Leafy greens, berries, healthy fats, and plant-based proteins support the body's natural defenses. Diet is not just fuel, it's medicine. And for aging men, it's one of the most powerful tools to protect the prostate. Most men associate dehydration with fatigue or dry skin, but few realize how deeply it affects urinary health, especially the prostate. Inadequate water intake leads to concentrated, thicker urine, which irritates the urinary tract. This irritation doesn't just cause discomfort, it creates a breeding ground for bacteria, setting the stage for deeper problems. When urine is too concentrated, it disrupts the delicate balance within the urethra and bladder. This allows bacteria to cling to the lining and multiply more easily. Over time, these low-level infections can ascend into the prostate, triggering inflammation and even chronic prostatitis. It's a quiet threat, often ignored until the damage is already done. Studies have shown that men who consistently drink less water have a higher incidence of urinary tract infections and prostate discomfort. The link is clear: hydration keeps the urinary system clean, lowers bacterial load, and reduces inflammation. Simple habit changes, like increasing daily water intake, can drastically lower these risks. For aging men, this becomes even more critical. The body's thirst response weakens with age, meaning dehydration can creep in unnoticed. Regular hydration isn't just about feeling refreshed, it's a protective measure. Clean, consistent fluid intake is one of the most underrated tools for maintaining a healthy, inflammation-free prostate. Long hours spent sitting may feel harmless, but the damage it causes, particularly to prostate health, is far from minor. Prolonged sitting reduces blood flow in the pelvic region, leading to poor circulation around the prostate. Over time, this limited oxygen and nutrient supply creates a fertile ground for inflammation and discomfort in the lower part of the urinary system. Scientific research confirms this connection. Men who live a sedentary lifestyle are more likely to experience urinary symptoms such as frequent urination, weak stream, and a constant feeling of not fully emptying the bladder. These signs are often linked to an increase in prostate size, which suggests that poor circulation contributes directly to prostate swelling and irritation. And it's not just office work. Hours spent driving, watching television, or sitting after retirement can all have the same effect. When there's no movement, the pelvic muscles become tense, blood stagnates, and waste products remain trapped in prostate tissue. Over time, this creates a perfect storm for inflammation and ongoing discomfort. The good news is that the solution is simple. Regular light movement, standing up each hour, taking short walks, or using a standing desk, can restore circulation and reduce pressure in the pelvic area. For older men, These changes are not just about mobility, they are a vital step toward protecting the prostate and improving overall urinary health. Urinary infections are often seen as minor inconveniences, but when they occur repeatedly in men, they can lead to lasting prostate damage. Each infection carries bacteria through the urethra, where they can travel into the prostate. Once there, these microorganisms may cause acute inflammation, and if not fully treated, they can remain hidden, leading to chronic bacterial prostatitis. The danger lies in how silent this process can be. A man may recover from the initial infection, only to experience vague symptoms weeks or months later, discomfort, burning sensation, or urinary urgency. Without realizing it, he's caught in a cycle where each infection causes deeper irritation and scarring within the prostate gland. As men age, this risk increases. Studies indicate that a significant portion of urinary infections in older men are linked to underlying prostate enlargement or reduced immune response. Once the bacteria settle in prostate tissue, they are difficult to eliminate fully with antibiotics, which makes early detection and proper treatment absolutely essential. Prevention is critical. Good hygiene, hydration, and prompt attention to any urinary discomfort can help avoid long-term complications. For older men, recognizing that a simple urinary infection can escalate to chronic prostate inflammation is key to breaking the cycle and preserving long-term prostate health. Chronic stress is not just a mental burden, it directly affects physical health, especially the prostate. When the body is under constant pressure, the brain activates the hypothalamic pituitary adrenal axis. This complex system releases cortisol, the primary stress hormone, which over time suppresses the immune system and increases internal inflammation. This biological chain reaction can quietly wear down the body's defenses. In the prostate, that suppressed immunity allows low-grade infections to persist and inflammation to build. What starts as emotional tension often ends up manifesting as pelvic discomfort, urinary issues, or chronic prostate irritation. Psychological studies have consistently linked high anxiety levels to chronic pelvic pain syndrome. Many men suffering from this condition report that symptoms flare during periods of stress. The discomfort becomes both physical and emotional, feeding a cycle that is difficult to break without addressing the root cause. Managing stress is more than a luxury, it is a medical necessity. Mindful breathing, physical activity, and mental health support all help lower cortisol levels and restore immune balance. For older men, this isn't about relaxation, it's about preserving the function of a gland essential to quality of life. Many men delay seeking help because they mistake subtle prostate symptoms for normal aging. Frequent urination, especially at night, a weak urinary stream, or discomfort in the pelvic area may seem minor, but these are often the first signs of inflammation or enlargement in the prostate gland. Ignoring them allows the problem to worsen quietly over time. In clinical practice, urologists frequently encounter men who waited months or even years before acknowledging these symptoms. By then, what began as a manageable condition may have progressed to chronic prostatitis or significant prostate enlargement, making treatment more complex. Early recognition is not just helpful, it's crucial. Real patient stories highlight this pattern. One man in his 60s noticed he was waking up to urinate 2 or 3 times a night but dismissed it. Over time, the discomfort grew, and only after developing pain did he seek medical help. Another patient lived with a slow stream for over a year, thinking it was just part of getting older. In both cases, earlier action could have eased their recovery. These symptoms are not random. They are warning signs from the body. When addressed early, many prostate conditions respond well to non-invasive treatment. Older men must learn to listen more closely, to view subtle changes not as nuisances, but as signals to act. Certain habits may seem harmless or even routine, but they silently aggravate prostate inflammation. Alcohol, for instance, acts as a diuretic and bladder irritant, leading to more frequent urination and increased pressure on the prostate. Smoking, on the other hand, reduces blood flow and contributes to oxidative stress, which can damage prostate tissue over time. Some prescription and over-the-counter medications also play a role. Drugs like decongestants and antihistamines may restrict urine flow by tightening the muscles around the bladder and prostate. When taken regularly without medical supervision, they can worsen symptoms in men already dealing with prostate discomfort. In the short term, these habits may seem manageable. A glass of wine or a cigarette might offer temporary relief from stress, and cold medicine may help with seasonal symptoms. But the long-term effects are far more damaging. The irritation accumulates, hormone balance is disrupted, and inflammation becomes harder to control. The solution lies in awareness and gradual change. Reducing alcohol intake, quitting smoking, and consulting a physician before starting any new medication are key steps. These small adjustments can have a significant impact, not just on prostate health, but on overall quality of life as men age. By the time many men visit a urologist, their prostate condition has already progressed. One of the most common frustrations among doctors is seeing patients delay basic screenings like the digital rectal exam and the prostate-specific antigen blood test. These simple tools can detect inflammation, enlargement, or early signs of cancer, often before symptoms appear. Avoidance is usually driven by fear or embarrassment. But postponing these exams does not make the problem go away, it only increases the risk of complications. Early detection makes a tremendous difference, not only in outcomes, but in the ease and comfort of treatment options available. Doctors also notice a pattern. Men who engage in regular checkups often avoid serious prostate issues altogether. They are more likely to catch inflammation before it becomes chronic, and more equipped to manage lifestyle factors that contribute to discomfort. This proactive approach isn't about paranoia, it's about taking control. Prostate health is not just a private concern. It's a part of aging that affects energy, sleep, intimacy, and long-term well-being. What your doctor wishes you knew is this: the earlier you act, the better your chances are, not just to treat, but to prevent. Awareness today can save years of discomfort tomorrow. If you want to stay one step ahead of prostate problems, join our channel's member club today. You'll get exclusive content, early access to expert interviews, and deeper guides on men's health that you won't find anywhere else. Here's the truth: chronic prostate inflammation doesn't happen overnight. It builds, quietly, through overlooked habits and ignored symptoms. But once you know what triggers it, you can begin to reverse the damage. Small changes, more water, smarter food choices, regular checkups, can make a powerful difference. So don't wait until discomfort becomes your new normal. Share this video with a friend, leave your questions in the comments, and subscribe now. Your future health may depend on the actions you take today.